Hi, this is Josh, pharmacist with pharmacisttips.com, here with a brief overview of the medication Cetirizine. We'll touch on the uses, dosage, and the side effects associated with this medication. Disclaimer, as with all my videos, informational purposes only. I'm not intended to replace your healthcare provider. You can read the full disclaimer below in the video description. So cetirizine, many people just call it an allergy medication. What it is, it's a second generation antihistamine. So it's newer than things like Benadryl, some of those older antihistamines associated with a lot of drowsiness. The newer second generation typically tolerated much better than that. US sold under the brand name Zyrtec. It's also available in combination products like Zyrtec D when it's combined with a decongestant. Cetirizine and antihistamines generally used to treat upper respiratory allergy symptoms. So, kind of all those typical sneezing, watery eyes, um, runny, stuffy nose. It's also used for hives or urticaria, kind of that rash that can occur due to some sort of an allergic reaction. Other uses include anaphylaxis, angioedema. Angioedema is when you get swelling of the throat and tongue and face, and certain infusion reactions for chemotherapy treatments. It's used prior to that to prevent some of those infusion reactions. Typical dosing, the doses, it's available in tablets, capsules, syrup, chewable tablets, all sorts of different ways. But typically in the outpatient pharmacy, adults are just going to get tablets. It can be taken with or without food. The regular dose for allergies is 10 milligrams once per day. Some of the other uses may go up to 20 milligrams twice a day. That would increase the risk of side effects when you're increasing the dose like that. And you're not going to take that dose unless recommended by a healthcare provider. Cetirizine side effects are generally mild and typically are reported to occur in less than 2% of people using the medication, so tolerated really well by most people. Side effects can include some drowsiness and fatigue, dry mouth, dizziness, nausea, and stomach pain. Other side effects are reported as well, but reported in less than 1% of people who use the medication. Some key points to remember when using cetirizine and any antihistamine or allergy medication for that matter. We want to be careful when alertness is required. We may not notice that the medicine is making us slightly drowsy or even slowing down our reaction time. So we have to be very cautious when operating vehicles and machinery. And we need to be extremely cautious with other medications that have a risk of drowsiness because the two together may cause drowsiness. So be really careful of that. Alcohol can increase the risk of drowsiness as well. So if alcohol effect could be more than you typically would have when you're taking an antihistamine with it. I appreciate you watching. Please like and subscribe.